Hello, everybody. Thank you so much for the introduction, and what a great talk from one of the people I look up to and inspires me every day with what she's doing in her work, in her practice, and how it's expanding. It's always great to see success when your friends are successful. So, great. Thank you for that. All right. So we have a smaller group here. So I do have some slides prepared, but honestly, I think I might just deviate from them and make this a little bit more interactive, and maybe tell my personal story on how I got to what it is I'm doing, this early on in my career. It really comes down to making sure the people around you are good people. They're going to push you to the next limit. They're going to open doors for you. They're going to help you get to that place that you want to get in life. And in advocacy, we have a saying in medical advocacy: you're either at the table or you're on the menu. And so if you need a reason to be involved with medical advocacy, that's it right there. If you're not actively fighting for yourself, someone else will just come in and take it. Someone will swoop in there and take whatever it is that you worked hard to get. They'll take it from you. And we're seeing this play out in so many different ways right now, with all the legislative battles that we're having in healthcare right now, whether it's scope of practice, out-of-network billing. There's so many issues that probably wouldn't exist if physicians were way more engaged. And I say that all the time. It's like, if doctors were more involved, if we could rally like the nurses do, if we could, function like some of these union workers do, and how they can shut down and bring an entire job or company to their knees, we'd be in a lot better shape. Healthcare would be the most amazing field out there. But instead, it's not. We have tons of issues. We have an incredibly high amount of loss of pride and joy in the profession. Burnout is what they like to call it, and it's frustrating because we all took a sacred oath to do right by our patients, and unfortunately we find ourselves getting blocked, impeded, and being able to do what it is we want. So for me, this is what medical advocacy comes down to. It's me making a difference on trying to remove some of those barriers that prevent me and my colleagues from providing care as quickly and as safely and as best as possible in the way we want to do it. So for me, when I was a first-year med student, or even when I was in college, I should say, I was already involved with advocacy. I think I get it from my mom. She was always the homeowners association president and stuff like that, and always fighting for issues that she cared about. So I think a little bit of that came to me. And when I was in college, I was at Berkeley. I was a community health commissioner there, and was able to set a lot of impressive progressive policy that Dr. Shaw probably loves. That kind of spiraled things on for me. That really set off a fire, set off like a light bulb in my head. And it showed me the power of what you can do if you're involved, if you're engaged. We found ourselves being able to really impact change at a much larger level. And I kind of make this comparison between micro and macro forms of affecting change. When you're with your individual patients, you're taking care of them, but you're not really doing much to really address the systemic issues, the bigger issues that bring your patient to you in the first place, or prevent your patient from having to, come to you. So that's kind of what kind of inspires me to do what it is I do. And so when I was a med student, continued my advocacy work, and unfortunately in med school, and even in residency and fellowship, we don't really get trained in this stuff. There's no formal advocacy training. We give lip service to this stuff. There's no formal leadership training. There's no formal business training. You don't get this anytime through high school, college. You kind of have to learn on your own. You have to hear from Dr. Navani and how to practice, how to build your practice, things like that. You have to go to the luminaries and things like that in your field to learn. And it's unfortunate because these are things that if you were trained how to do, you can start this stuff up early on and build your practice out early without having to go through the trials and tribulations or learning or spending years learning from somebody else. So in med school, I was very involved in the American Medical Association. For me, that was an outlet where I can actually learn some of this advocacy training, learn this leadership training, get mentors that really are striving to make a difference. And I still remember my first AMA meeting it was in Orlando. It was November of my first year in med school, and I met 3 people there who ended up becoming my lifelong friends and mentors. One of them was Jesse Ehrenfeld, who is, if you're familiar, if you're in the anesthesia world, he's just an absolutely impressive beast with what he's able to do on the advocacy front as well as in his scholarly pursuits. This guy publishes, once a week. I mean, he has a dubious distinction of publishing in New England Journal of Medicine twice in 1 week. I mean, most people are lucky to do it once in their entire career. He did it twice in 1 week. And now he's on the running. He's going to be probably our next American Medical Association president, anesthesiologist. And I still remember I was looking for a summer M1, summer year research opportunity. He's like, well, come to MGH. You can join my research team. And so, I ended up getting papers published with him. And it sort of built this lifelong mentorship where he was able to kind of advise me on certain things the way, especially when it comes down to advocacy-related items. And it's paid dividends, tremendous dividends. A second guy I met was Jerome Adams, who was just our most recent Surgeon General, anesthesiologist, regional anesthesia pain guy. Just a huge, phenomenal friend for me. He writes me recommendation letters that are amazing. So, and it's always good to have it when it's says signed by the 21st U.S. Surgeon General. But things like this, these open avenues and open doors for you. The idea of going out to these conferences as a first-year med student, walk around 1,500 of the most impressive doctors in America, and finding yourself in a position to really, grow as an individual and to be able to call on these folks to help you in important life decisions and kind of guide you and mentor you. So these are some of the folks that you meet when you go to these meetings. I mean, this meeting in particular for the pain world, you have the biggest luminaries in pain medicine here. The people that built the field, the people that are moving the field forward. These are tremendous opportunities for mentorship and leadership and advice. And, it's important that people take advantage of this. And I can guarantee you every person here is wanting to help. We're here because we care about the field. We're here to make sure the next generation is moving the field forward and not bringing it back. And that's why we come to these things, because we want to make it a better place for everybody. And that all ties back into advocacy too, because there are certain things that we do on the national front or on the state front or on the local front that help address these issues. For example, through COVID, our organization was very, very much on the front lines of trying to preserve our ability to practice medicine. We made amazing progress in telehealth, establishing waivers that are likely going to be permanent, that are permanent now, that'll allow us from comparable compensation to a doctor's, to an office visit. So things like that, things that we're doing that are moving the field forward, and this is all through the advocacy arm of this organization. That's the beautiful thing about this organization. How many pain societies do you get to go to where you have one of the most powerful senators sitting in the current U.S. Senate come and speak, completely ad lib for 45 minutes to an hour, and just giving you what's really happening in D.C. and how to push the items forward that we really care about. And there's not very many people that can do that, and that brings up the whole idea of relationships, and that's what advocacy is also really all about, developing and building these relationships. So Dr. Manchakanti, when he was 20, 30 years ago, when pain medicine was sort of becoming operational and this organization was started, he recognized that there were some fundamental challenges, and he realized that the only way to fix this was going to D.C. to build these relationships. And he's an immigrant. He wasn't born here, but he learned the system. He learned the power of relationships. And through those relationships, he and this organization and the people that have subsequently followed have been able to do so much. And these relationships, it's important to recognize, they're not born overnight. It takes months, years to develop these relationships. For some people, they start when the legislative member is in the state assembly or in the local community or city council member, and watching them rise up as they get older and do greater and bigger things. For me, that's how it was at Jerome Adams. When I knew him, he was not even Indiana State Health Commissioner. Then he became health commissioner, and then I still remember this. We were in D.C. once, and I think it was a lobby day, maybe for ASA or AMA or something like that. And I remember we're sitting next to each other, having a few drinks, and I asked him, this is when Pence had got the nomination, and he was a very good friend with Mike Pence because he was governor of Indiana. And I was like, well, if Pence gets the nomination, do you think, or if this has been Trump and Pence. No one thought they'd had a chance of winning, but like, in the event that they somehow won, what would you rather be? Would you rather be like HHA secretary or Surgeon General? And he's like, I'd probably rather be Surgeon General. Fast forward 6 months later, they won the election, and again, we were in D.C. again at the same bar. We're at Old Everett Grill next door to the White House, and he passes me his phone. He's like, I just got this email today. It's from the Chief of Staff, Reince Priebus, saying President Trump intends to nominate you for Surgeon General of the United States. And he's like, I haven't told my wife yet. I'm scared. But this idea of growing with people as they build their relationships, as you build relationships, as they rise up, and that's what makes the interaction so much more fruitful when you're there when they were essentially a nobody. And watching them rise up through this whole, watching them rise up, and that too, and that enables you to learn. That allows you to kind of guide exactly how it is that you want to take your way, your career, your trajectory. So all that stuff, it might not look like it's related, but it is, and it's hard to often see it. It's not a very, not a very binary thing. It's very much a gray zone in how you go about developing your roles in advocacy. So one of the biggest tenets also is just showing up. If you show up long enough, eventually things will just start happening to you, especially in healthcare advocacy, especially in medicine. It's kind of frustrating sometimes. Sometimes the fact that you haven't showed up enough is what deters you from advancing rapidly. Just because people have been around longer doesn't mean that necessarily are the best person fitted for their job. But what I've been able to do is, I showed up so much where, now that I'm only 4 years out of training, I'm considered one of the more senior people within the American Medical Association, even though I'm 36 years old and I've been in the House for 10 years. And, people come to me, they're my parents' age, asking me for advice on how to run their campaign, or how I can build support around these resolutions, or how I can go to D.C. to help make sure this issue gets passed. So that's one of the things about showing up, starting early, is that these opportunities that you initially have to go out and chase, but if you show up long enough, people start coming to you, and that's a very important distinction to make. And it's funny because you don't really recognize it. You don't really realize it until it actually starts happening. And he's like, I spent so much time applying for all this stuff, and then, at some point, people start inviting you to things. You get speaking engagements, you get board nominations, and then the network just expands. Your ability to make a difference, to influence policy, to influence anything or everything, it just escalates from there. You get invited to different leadership development programs that can really just shoot your trajectory even further. I've been fortunate to have had some formal leadership training as well. I did a couple of programs that have really made a dramatic change in my entire life. One being the Presidential Leadership Scholars Program. It's a program sponsored by Presidents Bush, both Bushes, Clinton, and LBJ, and their foundations. And that's just broadened my life to a crazy degree, where now I'm involved with so much stuff on the advocacy front, even further now, with issues not only in medicine but outside of medicine now. One being veterans issues. I'm doing a lot of work with veterans now and in the military and things like that. Things I've always been interested in. But this has actually provided another avenue, and there's another idea I want to introduce called informal authority. This idea that you kind of walk in, there's a certain air about you. There's something that people have heard about you, and my friends jokingly call it informal authority. And the important thing is that informal authority can lead to formal authority, and once you see that transition, that's something that you can then carry on and move forward and open your career and open your life to the most amazing opportunities. The kind of work I'm doing with the Pentagon, with the veterans issues that I'm working on. I mean, who ever thought a doctor who's not even in the military would be able to work to provide such crazy opportunities and be able to push the needle forward in so many different ways. It's crazy. If you would have told me 5 years ago I would have gone to Iraq twice to help reconstruct their healthcare system, I would have said, you're crazy. There's no way. How would I be in Iraq? Things like that. But this is kind of how it's a snowball effect. And you have to make sacrifices. And that's another part of advocacy, is sacrificing. As a resident, when I used to go to my meetings, my conferences, my program director did not want me to do this stuff. He said, you're crazy. I mean, I've been hearing this actually since I was in med school. I remember a lot of my mentors were like, stop wasting your time with this stuff. you should be focusing on learning. You should be focusing on all that stuff. I was like, yeah, that's fine. That part's fine. Okay, I got into med school. That's the hard part. Now it's just I gotta build up the other stuff. And I still remember my surgical chair at my med school. His name is L.D. Britt. He's the guy from Grey's Anatomy, the African American guy from Grey's Anatomy that he's actually inspired off of that character. He's a very old school Harvard MGH guy. Very much disciplined, and very intimidating guy. And he's like, I don't understand you. I've never seen somebody who just throws away my advice like you do. And, and then I heard that exact same advice in residency. My program director hated me for being involved. He didn't even shake my hand at residency, graduation. That's how much he hated me. But, the thing is that even though I faced such impediments, I still stuck to what I really valued. I didn't let that stop me. I didn't let people telling me no stop me from doing what it is I wanted to do, because I recognized the true importance of what it is I was doing, and it was for a larger cause. And what that meant for me is like all my vacation days during residency, I used most of them for meetings. I mean, I think I probably went home 3 or 4 times per year when I was a resident. And a lot of the other time I used for going to meetings, going to DC to advocate, getting invited to different conferences to speak on issues just like this to folks just like you. And so things kind of, it did suck sacrificing myself. I didn't go on these fancy trips like my co-residents were going on. They were going to Thailand. They're like, hey, do you want to come with us? I'm like, I would love to, but I have 10 more 10 vacation days left, and I got to go to AMA for 4 days. I got to do this for 3 days, and that's it. I'm done. And it's important that also when you get out, once you finally get out, and you look for jobs, and you show, for example, when I apply for jobs, it screams in my resume that this is something that's very important to me. And it's important that you go someplace that recognizes and values what it is that you are doing, and make sure that this is something you can continue to do. And early on in my career at SC, my chair loved it, and she was very supportive. She changed my schedule around. If I had any issues with anything, she just moved things. I just texted her. I was like, hey, Holly, I need to go to Sacramento. We're meeting with Newsom on this issue, or we're meeting with whoever on this issue. She would do it, and it made miracles. She made things happen for me very quickly. And so it's also important to share what it is you're doing with your colleagues. And bring them involved, get them involved in it. Not necessarily to the point of, do I want them all going to Sacramento? Do I all want them going to DC and taking time off? Not necessarily. A lot of them, that's not what their role is. But the important thing is making sure that your voice is stronger. And they can do that by several ways. Being a member is one thing. We're seeing tremendous drop-off, especially with COVID, of membership in medical societies. The lone one that's actually increasing membership is actually the AMA. The ASA, for example, has been dropping membership 10% for the past few years, like clockwork. And PAC donations is another way that allows us to support candidates who are friendly to the issues that we care about, and that's important. And it's important also to recognize that I was at lunch yesterday or a couple days ago. One of my colleagues was talking about how Nancy Pelosi is a witch and all that stuff. I was like, well, you have your opinions, but what if I told you that Nancy Pelosi is the one that saved us from this terrible out-of-network bill that would have completely crippled healthcare, and you would have probably had a 30% or 60% reduction in your salary potentially, and Nancy Pelosi was the one that saved you by stopping the legislation from moving forward? Does that change your perspective and opinion about her? Maybe, maybe not. But it's interesting how people can have they develop these ideas about these people, and then and how much it can lead to divisiveness in our society, in our culture. And then I went on further. I said, when we met with Speaker Pelosi, 2 Decembers ago to talk about out-of-network billing, she, the most powerful woman in the world at the time, she literally took out her own pieces of paper and started taking copious notes on our issue, because she cared that much about it. And she had 10 assistants in the room that could have easily been doing that job, but she took it upon herself to make sure that she understood our issues, and she understood how to keep us happy and how to prevent us from being completely decimated. And this goes back to the idea of relationships. The reason why we're able to get in that room is because our friends in the California Medical Association have developed these relationships with Speaker Pelosi, with her chief of staff, and this goes on for decades, for years. These relationships, and through them, you're able to leverage them to different issues. Instead of being on the defensive all the time, we're actually on the offensive on some issues. For example, in California, there was, this is completely off the record, but there was, a possibility of, prior to COVID, the elimination of prior authorization entirely in the state of California. We're just going to get rid of it. And that was an agreement that was actually already made. And COVID came in, torpedoed the whole thing. But I think it's something we're going to be able to go back to soon. And how tremendous will that be if we can eliminate prior authorization in the entire state and show that we can actually stop wasting 5 hours a day or whatever it is the average family medicine doc spends on prior authorizations. What if we can actually do that spending care at the bedside? So this is why advocacy is so important, because these systemic frustrations and issues that you all are facing, this is an avenue for you to actually do something about it. And when you're meeting with the legislative member and you tell them this is what you're doing, this is how I spent 5 hours of my day yesterday on hold with BCBS, getting the runaround on why my patient can't get a lumbar MRI. They want to hear these stories, because this is how you're able to take what you have, what your issues that you have, and actually do something about it. And I'm not saying that it's everyone should be doing this, but it's important to understand that there are avenues for you to make a difference, to make a bigger difference, to address these issues that really frustrate you. And I tell my colleagues, I love it when I hear people complain. I love it. I was like, oh, I love it. They're so mad about this. They're so mad about how much time they wasted on the phone with the insurance companies. Because my goal is that I hope it inspires them to actually do something more than just complain. And what I usually do is then connect them with resources to actually make a difference. I tell them, hey, call my friend Elizabeth McNeil. She's the head lobbyist for the California Medical Association in D.C. She'll be right on it. She'll tell Pelosi's office, and we'll try to get some legislation authored and put it through committee and see what happens. And suddenly you find yourself like, wow, my story can make that much of a difference, and it can, if the right person hears it. And that comes down to, again, back to the relationships. You have the right relationships with the right people. You tell the right story at the right time. Suddenly you find yourself being able to make a huge difference and really move the needle forward more than you could possibly imagine by taking care of someone's pain. So these are kind of my perspective on advocacy and how it's been able to move my career forward. And have I sacrificed a lot? Oh yeah, I've sacrificed tons of money. I mean, I'd probably lose at least $150,000 a year, and it's taken time away from being in the hospital. But it's what really gets me excited. It's what really motivates me. And for me, it's my way of making sure that I don't burn out. Even though it sounds kind of weird, because I don't even sleep on half these trips at all. And then I come back home and I'm like, oh my God, I'm so tired. Especially doing red eyes back and forth. Oh, forget it. But for me, it re-energizes me and it excites me and it gets me jazzed up and excited. So, but I've been talking for a while here. Any questions here from anybody? Feel free to shoot anything, any question you want. How did I navigate, dealing with bosses that were terrible, and didn't really appreciate what it is I was doing. That was a fun issue. I tell this story about when I was on my PEDS rotation, third year of med school, and the PEDS rotation coordinator person, the course, the head doctor for the rotation. I was invited by the AAMC to go lobby with them this is when they were trying to cut Medicare funding for residency programs. And they wanted me to go with them because I was just 3 hours south of D.C. and I worked with them pretty closely. And I remember she was like, absolutely, you cannot go. You need to be part of this rotation. I'm like, well, I was kind of like, I was getting very frustrated because I see she didn't really value what I was doing. And I told her, I was like, wait, listen, and this is kind of harsh and pretty crazy probably, but it's a story I like to tell because it just shows you how much I care about this issue. I told her, you're in pediatrics, okay? So who do you think is going to get cut first? Is it going to be dermatology? Are they going to cut residency programs for dermatology? I can guarantee it won't be derm. It's like, your specialty already is a big loss for the department, for the institution. Why should they bother training pediatricians when you guys come out making, $120,000 a year these days? It's your program. It's your department's going to get cut. And for you to prevent me from going there to advocate on your behalf makes me realize that you don't really understand the real politics of what's really happening here. And I remember she just looked at me and was like, oh my, who the heck is this guy? This guy's crazy. And then she just like told me to get out of her office. And then I was like, all right. And then, so then what I do next is I go talk to my dean, who loved me a lot, and she was awesome. I still talk to her all the time. And I told her, Dr. Babineau, this is, an issue I'm facing, and can you help me out with this? She's like, let me make a call. She calls her up. I get an email about 10 minutes later. It's like, you are cleared to go for your 3 days to DC. So, this madness. And people are like, you're nuts for doing stuff like that. I'm like, well, if it's important, people understand and appreciate the passion. Yeah. 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 Right. Yeah. So the question is, how do you advocate for something that you believe in if it'll cause potential professional harm to you or your department, or the illusion of harm, or basically how do you do for something without that'll potentially be a pain for your boss to deal with, and how do you avoid and how do you protect yourself? And that's a very good question. That's an issue that many of us in healthcare are totally facing today, whether it's NPs and encroachment on free practice authority and things like that, or CRNAs trying to get independent authority. It's a big issue, and it's something that I faced my first week of employment. I remember my first week at USC. Our grand round speaker was the ASA president at that time, and who knew me, Jeff Plagenhoff, who was like, I was like one of the few people in the room he knew, and he was just talking about all the stuff we do together, and then he was a very, it caused a lot of controversy in our department because he was basically advocating for team-based anesthesia care, and a lot of the folks in our department were very much not with it. And so for me, it was interesting because in a way that he kind of outed me as somebody who believes in this, who doesn't believe that CRNAs and NPs should be running around by themselves. And so for me, it was actually awesome because then the CRNAs basically they knew not to mess around with me because they knew I was like, okay, this guy, he's new here, but he's clearly, made his point, about how he feels about this, and it's a team-based collaborative environment. And it is unfortunate that people are having to face these issues. And I think it's important that if, it does involve risk, but I think it's as long as you speak from the heart and you speak with genuine concern, and and you have your opinions validated by data, which in many cases we do. I think it's as long as it's a just and noble cause, no one can really fault you for advocating for something that you really, really want to really believe in. And it's unfortunate that you're seeing such lousy leadership, for a better word, I wish I could call it something better, but it's not. I mean, it just comes down to lousy leadership for a department chairman who can't who's so afraid of this issue that they can't address it. I mean, that's just what comes down to. That's just bad leadership, I think, and that's something that's plagued healthcare and medicine for years. I mean, half the reason one of the biggest reasons why we're having so many issues right now is because of bad leadership. And that's another reason why we need to make sure we have leadership training, that we need to make sure that folks know how to deal with these sensitive topics and issues, because it's just going to keep getting worse. And you're seeing this across the country right now with the scope encroachments, especially accelerated by COVID. I mean, it's insane. And ultimately, who's going to suffer the most? And that's what really gets me the most. It's the patient. It's the patient who's going to suffer the most. And and it's unfortunate because I unfortunately think it's going to take a very high-profile incident to really help us move the needle forward, because we just don't have the ability. We've never really been united ever as physicians. Only rarely have we really been reunited. And probably the best example that I can think of is the fight to to place malpractice protection in the state of California, how we basically shut down the entire health system for 24 hours because malpractice insurance was exorbitantly high. So physicians, surgeons, obstetricians, anesthesiologists basically walked out in large numbers, and our lobbyists fortunately had a draft of a bill that set the malpractice cap for non-economic damage at $250,000, and that passed within 24 hours of being introduced in the Assembly, the Senate, and getting signed by, I think it was Governor Pete Wilson or Jerry Brown, I think, who signed that. But that just shows you how powerful it is. If we can unite on a common cause and a common issue, we can do it. And that's probably the best example of physician unification in America that I've ever heard of.